Hello, I am Aditi Dubey, and today we step into the quiet heart of Central Europe, a region of rivers and cathedrals of innovations and old wounds. But beneath the surface, in cells dividing invisibly, another story plays out, one written not in stone or steel, but in biology, lifestyle, and policy. Let's start with lung cancer. Across Central Europe, from the autobahns of Germany to the forests of Poland, lung cancer remains one of the deadliest diagnoses. In Germany, it's the leading cause of cancer death among men, and increasingly among women too, as smoking patterns shift. In Poland, the numbers are even starker, where high smoking rates, especially in older generations, have left a heavy legacy. And here is a sobering fact. In Austria, by the time most lung cancers are detected, nearly 70% are already in advanced stage. Screening is still in its infancy. And for many, the cough that won't go away is ignored until it's far too late. Now, turn to colorectal cancer. This one's a paradox. It's among the most preventable cancers thanks to screening methods like colonoscopies. And yet, it remains one of the most common and lethal in countries like Czech Republic and Hungary. Germany has led the way with national screening programs, detecting polyps before they turn cancerous. But in Poland and Slovakia, participation rates remain too low. The barriers? Fear, stigma, and lack of organized outreach in rural areas. Let's talk about breast cancer. It's the most frequently diagnosed cancer in women across the region. Austria has one of the highest incidence rates, but also some of the best survival statistics, thanks to early detection and structured care pathways. Poland, on the other hand, tells a different story. Rising incidence, but a persistent gap in outcomes. Mammography access, especially in poorer regions, can be limited. Cultural hesitations, even shame, still prevents some women from seeking help. Then there is prostate cancer, the silent growth. In Germany, it's now the most diagnosed cancer in men. It often grows slowly, but not always. The challenge here isn't just detection, it's deciding what to do once it's found. Active surveillance, surgery, radiation. The decisions are complex and often guided by access to informed counseling, something not equally available across the region. And finally, pancreatic cancer, the thief in the night. It accounts for far fewer cases but punches far above its weight in terms of mortality. In all Central European nations, survival is tragically low. Detection comes too late, symptoms are vague, and treatment options are limited. But even here, there is a spark of hope, like early blood marker studies in Vienna or AI models in Berlin that aim to detect risk years in advance. What we see across Central Europe is not just a list of diseases, but a reflection of systems, where they succeed and where they stall. Wealth matters, yes, but so do public trust, organized data, early detection, and education. These cancers, lung, colorectal, breast, prostate, pancreatic, are not strangers. We know their patterns, their warning signs, their molecular signatures. What varies is our response, how quickly we act, how vividly we scream, how bravely we talk. Because in the end, cancer is not just about medicine, it's about societies choosing to care early or care late. Thank you for listening.